So partograph is a graphical record of maternal and fetal conditions at the time of labor to assess the progress of labor and to ensure its normal progress and take timely intervention. ओके तो इसमें नेम, एज, पैरिटी, टाइम ऑफ रजिस्ट्रेशन, डेट ऑफ रजिस्ट्रेशन और टाइम ऑफ रप्चर ऑफ मेम्ब्रेन्स सब कुछ हम प्लॉट करते हैं. आई विल बिगिन विथ टेलिंग यू about the first marking, which is fetal heart rate. It has to be marked every half an hour. It has to be counted for full 1 minute after every uterine contraction. And then the second point is amniotic fluid. So if the membranes are intact, I. If liquor is clear, then C. If blood stained, then B. And if meconium stained, then M. Marking has to be made in this column. So then the next point is molding. So it is marked from 0 to +3 depending upon the grades. 0 is when the fetal skull bones are still apart, 1 is like when they are close together, and so on. Now the next column is where the actual plotting of cervical dilatation and descent has to be done. So this is started when active labor begins. That is when cervical dilatation is at least 3 cm or when there are 2 uterine contractions in 10 minutes. Whenever this occurs, you always have to record the time at that particular moment and you have to begin marking from the alert line. Now here I am showing you how to mark the descent part on the partogram. So per-vaginal examination is done first at the time of admission of the patient and then every 4 hours. Otherwise, if the membrane ruptures, to exclude cord prolapse, or if you want to do induction or augmentation, then you have to perform a PV. Otherwise, every 4 hours you have to plot cervical dilatation and descent. Then all the drugs and the IV fluids that are given to the patient, to the mother, they are plotted with their doses and their routes properly in this chart. Blood pressure and pulse are also recorded. So BP is recorded every 4 hourly, pulse is recorded every half hourly, temperature also 4 hourly it is recorded, and this way plotting is done. So urine tests of the mother for protein, acetone, and the amount of urine is also plotted and recorded. So if your graph grows towards the right of the alert line, then you have to get alert. If you are in a PHC or somewhere, then the patient has to be referred. And if it goes to the right of the action line, then immediate intervention is required and recommended.